let's look at more of CNN's propaganda with Bernie Sanders.
What I am worried about is that millions of people in our country cannot afford the outrageously high cost of prescription drugs. We pay, by far, more than any other country on earth, and yet last year, the top 10 drug companies made $69 billion in profits. 1 out of 5 Americans cannot even afford to fill the prescriptions that their doctors prescribe. That is pretty crazy. We're going to be going over the Canadian border to make a very simple point, and that is, at a time when we have an epidemic of diabetes in this country, we're going to take people into Ontario, Canada, and we're going to buy insulin. And you know what the differential is? The differential in prices between the United States and Canada is 10 to 1. 10 to 1. We're going to buy insulin in Canada for 1/10 the price that it is in the United States of America. And I think that issue is an issue that must be dealt with. We've got to take on.
You see how immediately when he starts talking about the issues that matter, she starts. Let me cut him off. Let me cut him off. He's making too much sense. He's making too much sense.
Take on the greed of the pharmaceutical industry.
And I know that you've recently announced that you are giving back any money that comes from Big Pharma, like Pfizer, et cetera. Clearly, this is the key issue for you. Let's dig into it, Medicare for All. There's a new poll out that I'm sure you've seen just yesterday, an NPR Marist poll. It just asked Americans a simple question. Do you think Medicare for All is a good or bad idea? 41%, only 41% said it's a good idea. 54% said it's a bad idea. 39% of independents only like it. And even 3 in 10 self-identified Democrats are skeptical. Why?
No, I don't think.
Why is it the best plan for America when a majority... Hold on, I asked the questions here. When a majority of Americans aren't behind it.
Well, obviously, you saw the poll that came out from the New York Times 2 days ago, in which 78% of Democrats thought that Medicare for All was a good idea, and 69% of independents thought it was a good idea. Medicare for All, depending on the wording of the poll, does very, very well. And the answer why it does well is the American people are sick and tired of a dysfunctional healthcare system in which over 80 million Americans are uninsured or underinsured, and we are spending almost twice as much per capita on it.
So sorry to cut Bernie off again, but I have to point out, and again, I'm not a political advisor here, and I'm not a strategist, but I'm just watching. I don't know why he doesn't say, well, you know, it's fine, Poppy, for you to cherry pick the polls that fit your narrative, but I'm sure you know there's other polls that show X, Y, and Z. Bernie Sanders, one thing that Donald Trump, he is growing more and more by the day into a fascist. I've avoided comparisons to Hitler, but I can't avoid them anymore. What he's doing at these rallies with center back and this race war he's igniting is very similar to what Mussolini, Hitler, and other fascists have done. If you don't agree, just do the research. Putting that aside, what he did expertly was punch the corporate media in the face in 2016. Of course, the reason he was elected, in large part, was the corporate media. But people like when their candidate or any candidate fights back against media lies. I don't know why Bernie Sanders continues to keep buying into premises and not pointing out that they are intentionally framing things a certain way. For example, I did a story last week on this anchor's co-anchor who showed one poll that fit his narrative and totally left out 3 other polls that showed Medicare for All has majority support. So I'm not sure why Bernie Sanders can't nicely say, Poppy, I understand that poll that you just showed fits the narrative you want to push, for your corporate station. However, there's a new New York Times statistic, as well as other polls that show the opposite. Point out that they are doing propaganda. Point out their bias. I don't know why he doesn't. Stop being so nice. These people are not being nice to you, Bernie. They are literally political operatives masquerading as journalists. So you don't have to be so nice to them. It's time to figuratively, I'm not calling for literally, punch them in the face.
And we are spending almost twice as much per capita on healthcare as do the people of any other country. The American people are sick and tired of seeing insurance companies become rich while they can't afford the healthcare that they need.
So let's talk about this a little bit more and what it would mean for the average American. You were on Fox News Sunday back in June with Chris Wallace. It was a fascinating interview. This is part of it that really struck me about whether Americans could keep their doctors, their hospitals exactly as they have them now under a Medicare for All plan. Here you were.
What we are talking about, despite a lot of misinformation coming from the insurance companies and the drug companies, is allowing all of the American people to continue to go to the doctor that you want to go to the hospital that you want to go to.
I really like my doctor, and I'd like to keep going to her. But what if she decides, Senator, that a Medicare for All plan doesn't pay her out enough, and she's going to just take private patients that I would have to pay out of pocket to go to her? And that's okay for me, because I can afford to. But it's not okay for most Americans. Could they still keep their doctor if their doctor decided these rates aren't enough for me?
So before I get to Bernie's answer, I want to point out, do you understand in the premise of the question and the premise of the whole segment, they are basically defending and advocating for a for-profit private insurance industry. That is what CNN and MSNBC are doing. So she is very focused on, well, what about in the rare cases where people are not able to see their doctor, where they see that as the problem? We need to ask them about that because it will be the exception to the rule that people won't be able to see their doctor. But they are very focused on the plight of the private insurance companies and the for-profit system, rather than the fact that the majority, an overwhelming majority of people can't afford to see their doctors. It's not about whether they could see the doctors they want. Currently, they might be able to see the doctor they want, but can they afford to go see that doctor? So we all have access to a lot of things. I could go and, go to an open house. I have access to that open house, but can I afford the house that's on the market? So this CNN angle and the entire framing of all of this, and it's not just this segment, it's all of them, is how do I advocate? How do I pretend to be a journalist and pretend to be neutral and pretend to be, worried about the American people? The question is, how do you keep a system where the majority cannot afford to see their doctor currently or cannot afford to get the lab work because there's extra costs for drawing blood, or preventative care, or mammograms, or a prostate check, or whatever it is. So this CNN anchor in the framing, and it gets worse, is just oozing with concern for the private for-profit system. And she's also misstating in terms of whether people's doctors won't participate. Let's take a look at more.
That is not the way the system is going to work. The system is going to work similar to what exists in Canada. And what we are going to see is an expansion of Medicare, where almost all doctors are now in Medicare, to cover every man, woman, and child in this country. What we are talking about is a 4-year transition period. Right now, as you know, eligibility for Medicare is 65. We take it down at the end of the first year to 55, next year 45, next year 35, and then we cover every man, woman, and child. And by the way, what we also do is expand Medicare coverage for seniors to include dental care, hearing aids, and eyeglasses, which are not currently covered by Medicare.
That matters. But I'm just asking you, the fact of the matter is that not all doctors take that because they don't all like the rates that they're paid. So can you 100% guarantee to all Americans that their existing doctor would see them under this plan and they would not have to pay out of pocket a private rate?
But as you well know, right now, all Americans cannot go to the doctor that they want within their own insurance program. And I think the system is broken and it needs to be fixed some way.
But you said earlier this summer that people could essentially keep their doctors in their hospitals. And I'm just wondering, is that 100% true for every American?
Well, under Medicare for All, as I said on that show, every American will be able to go to the doctor they want because doctors will be in the Medicare for All single-payer program, as they are right now in the Medicare program. Look, the time is overdue, it seems to me, to end a dysfunctional system which enriches the drug companies and the insurance companies, and do what every other major country on earth does: guarantee health care to all people, freedom of choice with regard to the doctor and the hospital. And at the end of the day, we will save the average American considerable sums of money on the amount of he or she has to spend on health care.
Okay, so that's your guarantee to the American people. We'll talk a lot more about it. No question, Senator, on the CNN debate stage, but I do.
So before I move on to the rest of the interview, which got much, much worse to the point where, see, that's the ambulance coming. That's the ambulance coming. I got to be honest with you. Some of you don't like it, but that was just a weak sauce performance by Bernie Sanders. It was. Now, he's running around the country, might be tired, whatever. I'm not, attacking him, but that was just weak. Because let me tell you something. What he should have said is, well, Poppy, you do understand supply and demand, right? You understand how the economy works? So if all Americans move into a Medicare system, Medicare for all, then these private doctors that you're currently saying not all doctors accept Medicare because they don't get enough of a payout. Well, this is going to be the entire consumer class, meaning including the entire American people are in the Medicare program, meaning that doctor isn't going to have a client base if they don't take the payments. Those doctors are not going to have patients if they're not willing to participate. Sure, they'll have if they want to be the exclusive doctors to the 1%, people who live on Park Avenue in New York City, sure, they could refuse to participate, but the overwhelming majority of doctors are not going to have a choice but to participate if they want to make any money. I mean, that's just how the economy works. That's how supply and demand works. That's how consumership works. So the point is, and I don't know why Bernie Sanders didn't say this, the doctors that you're talking about, Poppy, that refuse to participate in Medicare now, well, Medicare is only available for those 65 and older. In Medicare for all, every single person will be on Medicare for all. So these doctors are not really going to have much of a choice but to participate. It's not that complicated. And if they don't want to participate, then they could go find their own customers that are not on Medicare for all. Secondly, moving on beyond that point, Poppy, should we focus on maybe the 5 to 10% of people who are not going to be able currently to see the doctors that they see under the Medicare for all system, who I don't even think it's that much. I don't think it's going to be 5 to 10% people. This isn't Obamacare. This is a government system. Obamacare is a Republican private public partnership that was a giant wet kiss to the insurance companies. It's not progressive. It's not a progressive healthcare system. It's a market-based system. So, Poppy, should we focus on the 5 to 7% of people that might have to shop for different doctors, or should we focus on the 95% of people that will be able to see their doctor? You're trying to get some, gotcha soundbite that not 100% of people will be able to see their doctors. What is more important? The 95% of people that will be better served, or the 5 to 7% of people that might have their doctor not participate? I mean, the premise of the questioning is absurd. Their main focus is on preserving and whining and fighting it's under the guise of we at CNN and me, Poppy Harlow, are very concerned about the American taxpayer and the American citizen who might not be able to see their doctor because their doctor might not participate. In reality, they are mostly concerned for preserving the private healthcare system over at CNN, MSNBC, New York Times, the Washington Post, because they get very good healthcare through that system. These are not the people that have any at all connection to what the majority, you, for the 500 people watching, are dealing with day to day. Let me tell you something. The people at CNN have fantastic health care. Same goes for MSNBC. Same goes for the Washington Post, the New York Times, and most media companies. When I was at MSNBC, it was very good health care coverage with a very limited deductible, and the copays were affordable. So I got to tell you, and I'm not like attacking Bernie Sanders. Obviously, I support Bernie Sanders, but I can't be a fanboy here. If he's not explaining it right or he's not pushing back right, then I'm going to say so. If you don't like it, go somewhere else.
Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.